The Chinese authorities notified the world in late 2019 that there was a virus spreading across the populations. This extremely expanded to other countries over the following months. Severe acute respiratory syndrome coronavirus 2 is the virus that causes the disease COVID-19 or coronavirus. Continue watching to learn what the coronavirus does to the human body and what should we do about it. And please let us know about your personal experience with the coronavirus in the comments below. A virus is simply just a shell around genetic material and a couple of proteins, not really a living being. Corona may spread on surfaces and through the air, but it can only duplicate itself when entering a living cell. The most common spread is through contact with someone who has the virus, and then touching the openings in your face, eyes, or nose. The virus starts here and enters our body, targeting the lungs, intestines, bladder, or spleen, where the most drastic result can be accomplished. Only a few coronaviruses will cause the condition to be very dramatic. The lungs are lined with billions of epithelial cells. They are the body's boundary cells, covering the organs and mucosa in wait for infection. To insert the genetic material, coronavirus binds to a particular receptor on the membranes of its prey. The cell senses the initial virus and replicates these viruses until the cell breaks down. This cell melts down, releasing new fragments of coronavirus, ready to strike more cells. Within 10 days, millions of cells become, and billions of viruses are now in the lungs. Now your immune system gets involved, which is where the trouble begins. Your immune system invades the lungs to fight the virus, but instead, corona infects your immune cells, which actually helps the spread of the virus even further. They mainly interact with tiny proteins, called cytokines. They monitor nearly any major immune response. The infected immune cells feel ambushed and call for more immune cells to fight the virus, wasting the immune system's resources and causing damage. Two cells in particular are the main problem. First, neutrophils, which are effective at destroying stuff, begin destroying themselves. They start pumping out enzymes as they arrive and kill as many good cells as bad cells. The other significant group of cells that go into a frenzy are killer T cells, which normally order the killing of infected cells, both good and bad. The more and more immune cells appear, the more they inflict damage and the stronger lung tissue they destroy. Things can get so severe that it will inflict permanent harm, which leads to lifetime disability. In most cases, the immune system regains function gradually, killing the cells infected, prevents the virus from infecting new cells, and eventually heals the infected body. Most people diagnosed with corona should get through it without too much trouble. Meanwhile, other cases are becoming serious or even critical. In certain extreme cases, millions of epithelial cells have died and the protective lining of the lungs has gone along with them. Patients experience pneumonia, experience difficulty breathing, and require ventilators to survive. The immune systems work to full productivity for weeks, producing millions of antiviral weapons. It's exhausting because thousands of bacteria are quickly growing. They enter the blood and overtake the body, causing a higher probability of death. Many people compare coronavirus to the flu, but it is actually much more dangerous. While the exact death rate is constantly changing day to day, experts believe that it's more infectious and spreads faster than the flu. A pandemic like corona has two speeds, fast and slow. How we react to it in the early stages determines which speed it will spread. A fast pandemic will be devastating and cost many lives, whereas a slow spread is easier to manage and will cause far less of a lasting impact. The worst-case scenario for a fast pandemic begins with a very rapid rate of infection. Why is this so bad? In a fast pandemic, many people become sick all at once, and healthcare systems can't keep up. There aren't enough medical staff or equipment like ventilators left to help everyone that needs them. People will die untreated, and healthcare workers get sick themselves, causing an even bigger problem. If this happens, life or death will become a game of chance, and the number of deaths will rise at a higher rate. To avoid this outcome, everyone needs to cooperate together to turn this into a slow pandemic. A pandemic is slowed down when everyone does their part to stop the spread, especially in the early stages, because everyone that gets sick should get the treatment they need. Since we don't have a corona vaccine, our behavior needs to act like a social vaccine. This means not getting infected and not infecting others. There are a few simple preventative measures that you can participate in that will have a lasting impact. Wash your hands routinely. Use a mask when you must be around others. Avoid touching public facilities. Increase drinking water and get lots of rest. In addition, keep your hands away from your eyes, nose, and mouth. Avoid contact with people who are coughing, and do your best to practice social distancing whenever possible. We all depend on each other to be healthy in order for society to function properly. While many have the luxury to stay at home, there are some that can't, like healthcare providers, cashiers, and civil servants. And at the time of this video creation, there is a shortage of masks and other personal protective equipment in our hospitals. In an effort to do our part to promote a slow pandemic, we are raising money to quickly supply masks and other personal protective equipment to local hospitals. If you would like to donate to this effort, please visit our GoFundMe page by clicking the link below. All money raised will go directly to the purchase of personal protective equipment for our healthcare providers and those infected in our hospitals. Even a small donation can make a big difference. Thanks for watching all the way through. If you enjoyed this video, please subscribe to our channel and let us know your experience with the coronavirus in the comments below.